My name is Jackie Feldman, MD. Let's talk about mental health. I've been a physician for 36 years and a psychiatrist living here in Birmingham for the last 30 years. I speak to you now as a member of NAMI, the National Alliance of Mental Illness, and as a family member of 3 folks living with serious mental illness. But probably most importantly for the moment, I speak to you as a professor emerita at the University of Alabama at Birmingham, where I've worked in partnership with people living with mental illness for many years. I've treated probably thousands of patients and been blessed to help some of them, let's say someone living with schizophrenia. I've seen them be able to complete their education, get a job, buy a home, buy a car, get a girlfriend, but I haven't seen nearly enough numbers of patients be able to achieve that with their lives. These are the facts. Mental illness exists, and about 20% of the Alabama population will have their lives touched by mental illness in the next year, probably more because of the mental health consequences of COVID. At our present level of funding, we face untreated anxiety, depression, bipolar disorder, psychosis, addiction, and suicide. People who are desperate for care encounter barriers to evaluation and treatment. They don't know where to turn. Without prompt access and appropriate treatment, there are terrible consequences. Patients are overwhelmed with symptoms. Families are confused and bewildered. And systems of care, our Alabama systems of care, are overwhelmed. Folks who should be evaluated and provided treatment instead end up unproductive or lose their job. Kids drop out of school. Substance use soars. In addition, folks better treated for mental health and mental illness problems instead get diverted into the criminal justice system, which means more jails and more prisons in a system that can barely tolerate the burdens that they operate under right now. And tragically, preventable self-injury, suicide, and untoward deaths rob our state of precious lives. But you can help. You can save Alabama lives, kids, families, businesses, but that takes time, it takes effort, it takes political will, and it means that we need to expand Medicaid. Surely that's the place to start. I stand ready to come and speak with any of you, anytime, any place regarding any issue related to mental illness. Together, I know that we can help our Alabama citizens live healthy, productive lives, but it has to start now with Medicaid expansion. That's enough talk. Please fund mental health.